Get already low.
Good morning.
Good morning, good morning, good morning.
Julius, how are you?
I am fine, thank you. Yes, and how are you yourself?
I'm doing well. I'm not taking a vacation. I'm working and doing what I was before this virus.
Yes. And how is the lovely embassy and the staff?
Everyone's working, but many people are working at home. They're teleworking. Some of our American staff are working from the United States, so they're working late night, early morning. But all our programs are continuing, and one of those things we're not doing is processing foreign visas.
Oh, you're not processing?
We're taking calls from Americans that need help, and our programs are continuing. In fact, what we're doing in COVID is, in fact, in the last 2 months, we've spent over $5 billion just trying to help Kenya get through this crisis.
Wonderful, wonderful. I love that, helping Kenya, and we appreciate. Now, for example, what exactly are you up to in Kenya about Corona activities?
Well, here's the thing. I think Africa's doing well. I think Kenya's doing well. I think countries in Africa like Kenya are doing well because they're taking precautions. And everybody, what this comes down to is good health. It comes down to wearing, covering your face your nose, and your mouth, and washing your hands and keeping a distance. And sometimes, let me tell you, when you're in the estate, it's tough to keep a distance, isn't it?
Very tough.
Because you're close to people and you live close to people, and it's a real challenge. People can say stay at home if they want, but it doesn't make practical sense. And so, we have to keep a distance. We can get through this. I think we're going to find that we were very successful in the end. And I think other countries have experienced much more difficulty, many more deaths. And I think we just need to keep doing what we're doing, and we're going to get through this thing quickly.
Now that the numbers are shooting up in Kenya,
I don't believe that's true. I think when you increase your testing, you increase your positives. I think the rate that we've seen is steady, but there's just not enough tests to test everyone in the country. And so, whereas in the States they've tested over 15 million people, that would have been a third of the whole country of Kenya. They're able to do that. But we're not able to test everyone, and so I don't think it's, like I said, when you increase the test, over 3,000 like yesterday or the day before, and if you test 1,000 the day before, you're going to have 3 times the results.
Okay.
So I'm not sure, I don't think you should say that this is accelerating or out of control.
Okay, so you're in the opinion we are doing just fine, and probably we should let go.
No, I don't think we should go. I think we should be vigilant. I think we should keep doing the basic things that we found work, and that is washing our hands, keeping a distance, and covering our face. Listen, I want us to be out of this as quickly as anyone. MajiMaji, this is anti-Kenya. This virus is anti the culture of Kenya. Kenyans like being close. We like greeting one another. We like shaking hands. We like being together. We like partying together. We like eating together. This is not the way we like living, is it?
True.
Go back to normal as quickly as possible. But in order to stay healthy, you just have to take a few basic steps to stay healthy, and then we'll be through it, and then we'll be able to, go back to our close Kenyan self.
So what if our president was to call you, because he's preparing a speech on the 6th, and ask you, should he do away with the contain order, curfews and lockdown, and free the economy and the people, or should he still continue? What would be your advice?
Well, first of all, it's not, I have to always remember, and I do remember all the time, I'm a visitor. I'm not the one that's running Kenya. And do I want us to I want us to free the economy as soon as possible, as soon as it's reasonable. And I think Kenyan leadership has to make that decision when that time is. But I look forward to it, because look here, I think we have had, I think, 55 deaths. But think about the people that have been hurt because their job is related to the airport. Their job is related to tourism. Think about those people are not eating. I mean, that's suffering as well. And so I think we have to, I look forward to this economy opening back up because, truthfully, the government is not always the answer to your problems. We need government. We need good government. We need honest government. We need transparent government. We need government that's not corrupt. We need good government. But we also need citizens that are free to take care of themselves.
And now that we've gotten to the slum level, the disease has gotten to the slum levels, what is your advice to people listening to you? Because this station is listening to a lot from the BTL. What is your advice? And also, what is the U.S. doing directly to Kenya in terms of helping us in this situation?
Yeah, well, I'm glad you asked that. What we can do is exactly what I said. And that is cover your mouth and your nose, wash your hands, keep a distance, keep a practical distance. I was with some dual collie guys yesterday at some wood fundies over on Gong Road, and we're looking. I was asking them to make me a table. And I went into the wood shop and I walked around. Let me tell you, people are close. When you don't have much space, people get close. And so you have to make a decision to stay away and keep a distance. And practice good health, habits. I mean, it's tough, but we have to keep working, right? And so what the United States has done is many things. I mean, like I said, over 3.5 billion Kenyan shillings just in the last 2 months. But we're training over 34,000 healthcare workers. This is one thing people don't know. We've been stopping counterfeit test kits. We've been stopping counterfeit face masks. We've been stopping these things at the border and exposing them. A lot of people don't know everything that we do here in our embassy, but one of the things we do is we work with the border management, border control, and Kenya Customs, and we help them, and we've helped them find these counterfeit test kits that are coming into the country. And here's the thing too: we set up the first lab for testing for COVID, and we set up labs throughout the whole country. And then on top of this, you've got Coca-Cola, you've got Del Monte, you've got Facebook, Google, Microsoft, IBM, all investing a lot of money in these changing times in this crisis. Whether it's helping children learn online, or by WhatsApp, or even by radio. Those are programs that we're working on now, and the American people are investing big into Kenya because you know what? Kenya is the newest, best ally in Africa for the United States.
Wow, I didn't know about that. Now the numbers in the U.S. are up. Like now, currently 1,745,803. What can Kenya learn from the U.S. about COVID-19?
Well, interestingly, there's the prescription is pretty much the same. I mean, there's nothing. I mean, the prescription is so simple. I think we miss it sometimes, and then we get tired of hearing the same thing. Wash your hands, keep a distance, and cover your face. I mean, these are the same things people are doing in the United States. And we can't be looking for this miracle vaccine to keep us from behaving badly. And the truth is, if you look at the people that are suffering from this, these are the people that are not healthy. These are people that have pre-existing conditions. And so the best thing we can do is be healthy. In the United States, you've seen large companies shifting from making cars to making ventilators, from making linen and clothing to making PPEs. And we've seen the same thing here in Kenya. We've seen people shift here in Kenya. I mean, we've set up some some really nice manufacturing facilities here in Kenya because of this crisis. And I think we have to be thinking now, how do we keep this going? How do we keep this going? In fact, even now, we set up manufacturing en masse here in Kenya, and we've donated over 100,000 masks, and those are made here in Kenya by Kenyans. And so, the next step is, how do we keep working? How do we keep manufacturing, not just for Kenya, but for the world?
Okay, then according to you, what would be the new normal?
The new normal?
Yeah, in terms of health, in terms of lifestyle, in Kenya.
Well, I think gradually we're going to get back closer. When the risk is less, we'll be closer. We won't do everything the same. I mean, we'll do more. I'd like it if I could be there on this radio program with you in person. I think we'll do that.
That's confirmed. That's confirmed.
Yeah, we'll be back in person doing those kinds of things, but we'll still be doing a lot of meetings online and by video. But because we're getting better at it, remember the first video conference goes like this: "Hello, hello, can you hear me? Can you hear me?" And half of the meeting is people asking, "Can you hear me?" Now we actually get on the meeting and we get business done. And so I think things we'll make a few adjustments, but the biggest adjustment we have to make is getting back into larger manufacturing and actually putting more people back to work.
Currently on air we are discussing matters education, and it's a big issue that's concerning parents and the government and the students.
Yeah.
In your opinion, should we do the exams for the candidates in 2020 or consider postponing it?
Well, I'm glad I'm not the head of education right now, because that's a very tough decision to make. I do think that we're going to have to change the way that we educate children. I think we're going to have to make it possible, not just for the rich, but even the poor and those in the rural areas to be able to have access to online learning. And whether that's by radio, whether that's by WhatsApp, and this is something that the United States right now is making a complete plan for to present to the government of Kenya. And we think it's going to be the best in the world. We think Kenya is going to have the best online learning in the world if we can implement these programs. And so, as far as the test, I'll leave that to the Kenyan government. But I'll tell you, I think that we can do things differently. I know Loon. Loon is a company that's now giving internet coverage to almost 80% of the country now because of the balloons that are providing that. And so we're going to see some advances in technology that help children learn. And I think this is important because, think about it, it's the most important thing in your family. Is having a student that gets a good exam chance to take a family out of poverty. And so I know it's very important, and because it's very important, we're going to try to take Kenya to the next level on online learning.
Thank you. I want to confirm that you're invited and welcome to the station once we are safe. I think we are, so that we can have more talk about Kenya, about the US, about the ghettos, informal settlements, what can we do together, how we can advise the youth, etc. I want to invite you for such an interview sometime. But however, can I ask a funny question about a video that was trending yesterday?
Which one?
There's a video that was trending from the US yesterday that Kenyans got very involved. It was trending so much. We got so many calls. You've not seen it?
Which one is it?
Oh, so about about some police.
Oh, the police.
Yes, in the U.S.
See, here's the thing. Let me talk about that. I saw it. I haven't watched it, but I know the incident. I'll tell you one thing. The President Trump responded saying that he was actually sending in the FBI to make sure that these people were held accountable. President Trump is not happy about this. He's taken action on this, and no one is going to get away with police brutality. And no one should get away with police brutality in Kenya. This is one of the things, we're giving a lot of masks to the police. There's no reason for anyone to get arrested for not having a mask. We're telling the police, here's 50 extra masks you can put in your pocket. And if someone doesn't have it, give them a mask. Don't arrest them. It's that simple. Why bring somebody to jail just because they don't have a mask? We're manufacturing these for 25 shillings. In Kenya, there's no reason for 25 shillings to go to jail. That's crazy. And so we've given it to the police. We actually are giving them to the radio stations. In fact, we're sending some over to you.
Thank you.
If you can give away to some of your listeners. And, these are simple things we can do to get through this crisis together.
I want to thank you for your time. I'm humbled, privileged, and we're looking forward to get the masks and share with our listeners.
Thank you, MajiMaji. I appreciate it. Thanks for the work you're doing, because you know what? You're one of those people that has great influence with your community.
Oh.
And you can listen. You can get us through this crisis. I mean this. You can do it because you have the power to speak to the Wananchi. You have the power to give them good instruction as to how we can get through this thing. Because the solution is not just in the government. The solution is in the people, and the power is with the people. And I'll tell you, I had a government official one day, and we actually walked down the street, and that person was being greeted by all kinds of people. People were honking their horns. They were shaking this guy's hand. And I thought about it. I said, you know what? You know where his power comes from? His power comes from the people. Because the people trust him. And so the trust that people have in you and your message can do a lot of great things. And that can get us through this crisis. So let's not always look to the government as our miracle and as our source. Let's look to our neighbors, and let's look to the Wananchi who have the ability to get us through this.
Asante sana.